One of the key aspects in multiple sclerosis, because of the obvious therapeutic implications, is to try to understand when we start to see mechanism of neurodegeneration active in the course of the disease. MS typically has an early phase with attacks and new lesions, wave of inflammation then from the periphery enter the central nervous system. And later, what happens is that we start to see an accumulation of disability that is becoming largely independent from these waves of inflammation and attacks. Usually, we define that this conversion from relapsing-remitting to secondary progressive is taking place when there is a moderate level of disability. With the DSS scale, the level of 3 or 4 have been used. And the reason is that in reality, it's extremely difficult to say exactly when we start to have this mechanism. There are two opposite views here. The first one is that the progressive phase of the disease starts immediately with the onset of the disease. Maybe even in the preclinical phase, you may have these mechanisms that are evolving. The reason why this position is in some way driven the view of many researchers is because when you have a lesion, in some of the cases, this lesion may continue to evolve instead to just end after the acute phase of inflammation. This is now defined as a smoldering lesion. And it is clear that if there is a certain amount of these lesions already evolving, then you have the possibilities to start to have a level of degeneration taking place. From the other side, the opposite view is that in MS, we have really an early phase where essentially we have just a damage that is linked to the presence of new lesions, one after the other occurring in the CNS. And the phenomenon of degeneration is not mandatory because if you intervene very early, you may have the opportunity to prevent this transformation of relapsing-remitting MS in a chronic progressive disease. So which are the evidences? So in the debate, I was asked to defend the view that the relapses are very relevant. That means that the early relapsing phase of the disease is characterized by damage that is predominantly related to this wave of inflammations. My opponent, that was Professor Giovannoni, was assigned with the view that the disease is there since the beginning and the lesions and attacks are just an incidental problem when a more, let's say, intense inflammation is taking place. And everything could be driven by something happening in the central nervous system since the beginning. And here the hypothesis now is that it could be the Epstein-Barr virus that is present in the central nervous system, and it may occasionally reactivate with attacks, but in any case, the presence may also result in some continuous evolving damage that will determine the mechanism of neurodegeneration. But why I defend it, and I'm convinced, still convinced that is my position the one that is the right one, even if I lost in this debate. The reason is that with the anti-inflammatory treatments that prevent relapses, prevent new lesions. In the last 10, 15 years, we have changed completely the history of MS. Now, the majority of patients, even after 20 years, do not enter a clearly evident progressive phase of the disease. Of course, as I showed, there is a small proportion of cases where we may start to see some evidence of mechanism of neurodegeneration, evidence of progression in a very early phase of the disease, even in the first 5-10 years. But this proportion is around 5, 6, 10% at the highest level. So, and I, in some way, introduce a lot of arguments why the PIRA condition is as it is being used until now, is not the most appropriate way to reveal the early progression. And I essentially demonstrated that most of the PIRA progression independent from relapse activities, so deterioration that was independent from attacks, in reality was related to inflammatory activity, presence of new enhancing lesions in the brain. So if you use an appropriate, a more temporal appropriate sampling of what happened, you may reveal that the majority, I have to say, of PIRA condition in reality are not independent from inflammatory activity. Okay, that was really the type of debate we have. And finally, also coming to the hypothesis of Giovanni that the Epstein-Barr virus is the dominant actor of all the disease. I think that it's still clear that the virus is present in 95% of our bodies. Nevertheless, only 1 out of 1,000 patients have MS. So it is clear that you need also some other incidental conditions that may help, and we know some of these conditions.